This was intense, corner by corner, house by house fighting with suicide bombers operating virtually almost every day. And so the risk to health personnel operating near the front line was substantial. It was quite difficult to get many of the traditional partners to place their health personnel that close to the front line. The way that ultimately it was addressed was to take humanitarian health workers and place them with Iraqi security forces. Functionally, they became embedded. That raised questions for many in the humanitarian world because it appeared to be a violation of neutrality. Our job as part of the evaluative team is to make sense of this, to really understand what the impact was, how effective was this approach, but also what potentially this could mean to the broader humanitarian effort. The first question that everybody asks is, did this save lives? And the answer is likely to be yes, it did, which puts a burden on those who embrace very strict interpretation of humanitarian principles of independence. Part of our job is to grapple with these tensions and contradictions in ways that will provide guidance for the future. These kind of protracted conflicts are relatively new at this scale. You have to bring different disciplines together in ways that nobody really has done before. We need political scientists, we need global security experts, we need health and public health technicians, we need people with experience in providing humanitarian services in these complex environments. While our base is at Stanford, we have very strong collaborations with other academic institutions because we recognize that no one institution is going to be able to address this broad and complex a challenge. One of the great things about Stanford has been how welcoming the Stanford community and academic environment has been to this kind of engagement. It's a relatively easy place to create new kinds of interdisciplinary collaboration. And that includes ensuring that while we're very proud of the wonderful capabilities that exist here on the Stanford campus, that those capabilities are actually engaged in real-world settings in some of the poorest and most violent places on Earth.